Our group did a slightly different approach. So we took patients with oligometastatic disease and gave them locally ablative therapy up front, and then tried to see how immunotherapy would affect their outcomes. So we added pembrolizumab for 6 to 12 months amongst 45 patients, and we compared their outcomes to a historical control. We were able to show that the addition of immunotherapy was associated with a substantial improvement in progression-free survival over our comparison to historical control. So the numbers that we saw was a median progression-free survival of around 19 months, as compared to our historical control, which was about 6.6 months. Now that historical control, it's a little tricky, right? The data's all heterogeneous, it's scant, but even if you compare our median progression-free survival to the data seen from the SABR-COMET study or from the Drs. Gomez or Iyengar study, which were randomized studies looking at locally ablative therapy, the data from our study do compare favorably. I think that what would be an ideal next step would be to evaluate locally ablative therapy alone with or without the addition of immunotherapy.